setting up the meeting.
Sorry, bro.
Yes.
Have you clicked live already?
Yeah, they are loading.
Yeah, nice.
Okay, ladies and gentlemen, as you can see on the top left corner, you can see live on Facebook. I wonder if you can see that. But right now we are officially live. And Thomas, I will hand over the host to you. And good luck to Jax and Thomas. Have a good session. Take care.
Thank you. Thank you. Hello. Good evening, everybody. How's everybody doing there today? Hi, can everybody hear me there? Hi, Jax, can you hear me as well?
Yes, I can hear
Wonderful.
clearly.
Wonderful, wonderful. Yep. Thank you for being around today. As to, we're going to cover a very interesting topic.
Yes, my pleasure.
On your subject, which is basically promoting mental health. You know, in all the in what we're looking at is in the situations that we have, you know, communities that are looking forward to this. But of course, we would like to, you know, before we start, we would like to look into some of the areas that have actually impacted it, and how we can, you know, come out with strategies or solutions to, you know, to come up and create some sort of awareness for people who are, you know, having an issue, and what we can do about it. So, you know, I understand that, you know, COVID-19 has actually had an impact, and we have actually seen a lot of people laid off from jobs, and things are getting really hard. And I mean, am I right on that, Jax?
Yes.
Yeah. So what's happening right now is we are trying to come up with a solution, and I think that's where we've got Jax, Mr. Jax here, who is an educator, an artist, a volunteer in psychometrician, and mental health advocate. And he's a full-time lecturer at Far Eastern University Cavite under the psychology department, where he serves as the advisor of the Psychology Society as well. And yeah, he's currently finishing his master's degree in psychology, majoring in clinical psychology at the De La Salle University das Marinas. And Mr. Pagtalunan is also an active member of the Psychological Association of the Philippines, Pambansang, Samahan sa Psikologiyang Pilipino and Philippine Mental Health Association. And moreover, he's the Community Service Director of the Rotaract Club of MetroPoblacion, Silang, Research and Development Head of Astolica Learning and Development Center of Mental Health PH, and the Provincial Coordinator for Cavite of the Psychological Association of the Philippines-CALABARZON and MIMAROPA. And he's frequently invited in various seminars and workshops to discuss topics that concerns mental health and well-being. And Mr. Pagtalunan is also the current president and co-founder of the SinagDiwa Volunteers for Mental Health, a non-profit volunteer organization which aims to bring proper mental health awareness and help to become more closer to communities, to training, collaboration, and outreach. And here he is today to promote this topic, which is called mental health programs among communities. So I'll leave the floor to you, and then let us make this more interactive. So guys, feel free to fill in with your questions, and we can make it more interactive. So if you have any questions along the way, please feel free to let us know whatever your concerns are. Leave a shout out, and we are here to listen out to you. So I'm leaving the floor to you, and have a good one.
Oh, thank you so much for that very wonderful introduction, Thomas. I really appreciate that.
Pleasure.
And I hope we can have an interactive discussion this afternoon. So again, hi to my if I have I believe I have some students watching right now and
Yeah.
and to all the audience of YANA. And again, we're very grateful to YANA and
Yep.
for this particular project and platform, enabling us to have these kinds of conversations, which is actually very important, especially considering what's happening right now. Now, let me share my screen.
Okay.
So I had prepared some presentation here. I hope it is visible.
Yep, I can see well.
And please bear with the internet connection.
No problem, understandable.
Thank you. I just there are times that it's slow. Anyway, my talk for this afternoon is about promoting mental health awareness and programs among communities. Uh, as said in the introduction earlier, um, among all of my identities, probably one of my favorite would be being a mental health advocate. I've been doing this perhaps for the last 10 years, if I'm not mistaken, and I was still a student. And when I graduated, well, with a degree of psychology, I take use of it to further help people and open a conversation regarding mental health awareness. Now, before I continue with this, I would just like to go back to what is the mental health scene, perhaps in the Philippines. 10 years ago, during the time, there's still no mental health law in the country, which of course makes it very difficult. And also, we don't have any licensure examinations for psychologists. So technically, we are having a lot of problems and concerns with regards for competent mental health professionals, perhaps. So because of these problems, it is very rare to see mental health programs. There are, but there are less mental health programs among the communities where I was living in. And if you put that into consideration, I was living actually in rural areas or cities at the time. So if that is the scene in the city among the cities, what more in the urban areas? How about in the rural areas, the outskirts? So I'm very concerned as to how they could afford mental health services because we have less psychiatrists and less psychologists by the time. But fast forward 10 years from that moment, the early years, because there are a lot of organizations and people, non-profit organizations, individuals who are actually very cooperative when it comes to this kind of cause. And I'm very happy that now I can notice that people are starting to be very accepting and open to talk about this, especially in social media. You are familiar with it. Um, yes, and like our organization and Diana, we use social media as well, like what we're doing right now as a platform for this kinds of conversation.
Yeah.
Now, in before I continue with the actual body of the presentation, I just would like to ask you, in Tagalog or in the Philippines, we say kumusta ka?
Exactly. Yeah.
Or how are you? Okay?
Yep.
So I would really like to know if the audience are our live audience are. So if you can describe how you are doing right now in one word, please comment.
Yeah.
How about you, Thomas? How are you doing?
I'm doing good. I'm doing all right. Try to, amidst of all the calamities, of course, we have to,
Hmm.
be, up and about with the spirit. So very good, actually. Yeah. How
I'm
about
very
you?
glad.
How are you
I'm
doing?
very glad to hear that. Well,
Nice.
in my case, in my end, well, it's almost the same. I have been to a lot of community activities lately, and
Okay.
I would say that yes, there's still a lot of people who needs help. But in my
Mm-hmm.
case, I'm not trying to invalidate their struggles. But in my case, I somehow thankful that I am in a position which I
Mm.
can help them.
Yeah. 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 Okay.
And
Okay.
yes, and I do hope that the people who's watching this
Mm.
can also help us as well.
Yep.
Anyway,
Yep.
how about the people in the comment section? I hope you can share how are you doing right
Yeah,
now.
guys.
Anyway,
How are you all feeling today?
how am I feeling today? Maybe I usually ask this. So when
Mm.
people ask me that, I I tend to think very deeply,
Yeah.
but perhaps more on excited. I believe
Nice.
excited,
Okay.
calm.
Mm.
Especially this is the first time,
Yep.
the first session between our organizations.
Mm.
Anyway, uh, I would just wait for the answers of the others later. I would just try
Mm.
to look at the live stream. Um,
Okay.
I will go back now to the. Maybe you're very familiar with this, guys.
Mm.
This is the um, description of mental health according to the World Health Organization.
Mm.
So, according to the World Health Organization, mental health is a state of well-being
Yep.
well-being in which individuals realizes his or her own abilities. So there is self-awareness there. And
Mm-hmm.
because you have that kind of awareness, you can
Mm.
cope with the normal stress of life. Especially
Mm.
stress is very much normal.
Mm.
It's not normal is unmanaged stress. You
Mm.
can work productively and is able to make contribution to his or her community.
Mm.
So with this part, we can see that being able to cope with the normal stresses of life and being adaptable, and you have this particular capabilities, you would now be able to contribute to the progress of the community.
Mm.
Since it was very emphasized here in this positive sense,
Mm.
mental health is the foundation. It's the foundation for individual well-being and further the effective functioning of a community.
Mm.
That's why I always cling to this particular statement,
Mm.
where mental health is very much important, not only for a person, for us as
Mm. Mm.
individuals or for
Mm-hmm.
our family, but for the
Yeah.
community at large.
Okay. Yeah. Yeah.
So just try to imagine I always try to imagine a community or society which everyone
Yeah.
is experiencing optimal mental health. I
Mm.
believe that is a key for a progressive community.
Mm.
Anyway,
Mm-hmm.
in summary, usually I say this in summary because some
Mm.
people are very much confused with the paragraph. So there
Mm.
are actually four. The first one again would be can tackle the normal stresses of life.
Mm.
Second would be we're aware of our abilities. Third would be we can work productively,
Mm-hmm.
and therefore we can contribute to our family and communities.
Mm. Mm-hmm.
And also, it is very important to go back to this particular continuum.
Mm.
Um, Earlier, I have a talk with a particular school,
Mm-hmm.
and most of them, when I asked them to gauge their well-being as of
Mm-hmm.
the moment, most of them are in the neutral point, at the
Mm-hmm.
middle. Okay, they
Yeah.
would say okay lang, okay, or
Mm.
in they're okay,
Mm.
middle.
Mm-hmm.
Okay. So anyway,
Yep.
I would just like to remind this to people because the wellness paradigm, this is what we usually use in the mental health practice.
Mm.
Um, well, most people would say that they're neutral. They don't have any disorders or mental health concerns, but at the same time, they do not feel optimum well-being.
Mm.
So they're in the
Mm-hmm.
middle.
Yeah.
Uh,
Yeah. Yeah. Of
Now,
course.
however, in some cases, okay, uh, when stress is unmanaged or we have particular adversities in life that we cannot actually address properly, we might,
Mm-hmm.
as you can see the left side, I believe this is the left side, we can grow closer to the left side, which you would see their signs, symptoms, and of course, we don't want that. But
Yeah.
if it is developed, ultimately, it would lead to a disability or a
Mm.
psychological disorder. And
Mm.
extremely, in the extreme left, would be a
Yeah.
premature death. And
Okay.
obviously,
Okay.
we don't want that. Okay, that's
Yeah.
why we're
Mm.
having these kinds of conversations and a lot of programs to prevent, to
Mm-hmm.
mitigate these kinds of
Mm-hmm.
um, situations.
Mm. Okay.
Now,
Okay.
this is our goal, the other side, the right side. The right side
Mm.
would be, as you can see here, just one step above the neutral
Mm.
point is awareness.
Mm.
That's
Yeah.
why
Of
these
course.
kinds of webinars, live streams about mental
Mm.
health conversations
Yeah.
is very much important because the people watching right now, our audience or the people who are sharing this,
Mm.
would have a certain level of awareness. This
Mm.
awareness would now lead to education or psychoeducation,
Mm.
would now further lead to growth.
Yeah.
And hopefully someday would, if we have a better policy on mental health and
Mm-hmm.
people are more accepting of going to a mental health professional,
Mm.
we will achieve a high level of wellness.
Mm. Mm-hmm. Yeah. Of course. Yeah. We're looking towards that actually. Yeah.
Now, of course, I hope our audience now is connecting the dots now. Not
Yeah.
why
Yeah.
should we promote mental
Mm.
health among
Mm-hmm.
communities?
Mm-hmm. Mm-hmm.
Now, I would show you some infographics. These are not my infographics.
Okay.
I downloaded them. I downloaded this from
Mm.
NAMI, or National Mental Health Institute. Anyway,
Okay. Yeah.
so this I would not read everything. I would just focus on the very salient parts,
All right.
especially the information that would concern Southeast Asia.
Mm.
Um, as you can see here in their data,
Mm.
almost 15% of Asian adults,
Mm.
this is the prevalence of
Mm.
mental health illness for the
Mm.
past year.
Mm.
So 15%. Okay, though I cannot compute it right now, but
Mm.
that is a very big percentage.
Mm-hmm.
And of course, that 15% is composed of different Asian
Mm.
regions: South Asia,
Okay.
East Asia, Southeast Asia. And I was actually researching about the mental health in Southeast Asia. There are some researches, but they are very much exclusive. But
Mm.
what I have seen and noticed for most of the related literature I've read is that Asia is actually leading in the production of the psychiatric drugs for
Mm.
medication. But it
Mm.
was actually ironic that most of the Asian countries in the Asia Pacific in Southeast Asia have less programs and policies when it comes to mental health care.
Mm.
Now, anyway, I would show you some tables later about that. And we always have this slogan that mental health care matters. Mental health matters. Mental health is as important as physical health. It's very true. However, of course, since mental health is something that you cannot see, I mean, when you look at a person, you cannot obviously see what is happening inside him in comparison to a physical disease or dilemma. Okay, it is quite harder for some to actually understand why mental health problems happen. But anyway, it was stipulated here that people who get treatment in a given year is around 43%. This is around the globe. Okay?
Mm.
64% of adults with serious mental illness, this is more than half of the population. And 51% of youth, 6 to 17 years old, have a mental health condition. And the
Mm.
adolescent age, if I'm not mistaken, 13 to 24, is very vulnerable right now when it comes to the developing or development of
Mm.
different mental health conditions. So
Yep.
it is very alarming because these are the young people. Anyway, as stated here, adults with a mental health diagnosis receive treatment and counseling for the past year.
Mm.
Uh, there are at least 25% of Asian adults who, from the 15%,
Mm.
actually received some kind of care.
Mm.
But again, that is just a quarter of the people with mental health concerns. And a lot of issues or concerns would now go into this particular data, such as the affordability of mental health care,
Mm.
the availability of the actual clinic or psychological clinic or organizations
Mm.
or hospitals that offers mental health help.
Mm.
Now, the reason why community must be a target when it comes to mental health programs such as psychoeducation programs, mental health campaigns, is because of the ripple effect of the mental illness.
Mm.
So usually, when a person is diagnosed with a mental health disorder or psychological disorder, uh, that when he undergoes a psychological assessment,
Mm.
it would be looked into through different lenses.
Mm.
Uh, we would try to know the personal history, the
Mm.
familial history, the background, the environment where he lives in, the school, the or workplace. Because in the practice or in psychological assessment, it is established that a person interacts with the environment, with people. And so therefore, these people or environment might affect how would his mind or works. Now, as you can see here in the ripple effect, like when you throw a stone in the water, there will be ripples. From the person or individual, okay, it is surrounded by the family. So, uh, very much what kind of family we grow up with or the family that raised us would affect how would we develop our personality, how we cope, uh, our adversity quotient. Now, if we have a very caring and understanding family and a family which is very open to these kinds of conversations about mental health, then there would be less chances that a person would have a risk factor for the development of psychological disorder. However, if it's the other case around, it might it might be one of the factors that why a person might have a uh, adversity that might cause the development of a particular disorder. Now, the family is a basic unit of the society, and therefore it would be now seen in a more macro level. And since we're talking about communities here, and communities are composed of different families, so if the community is a place which is, if I may say, not open to this kinds of conversation, especially with, I noticed it with the youth. They often tell me that they are scared to ask for help because their neighbors, they're actually concerned about their neighbors. Their neighbors would judge them, or their family would not actually allow them to go to a psychologist or mental professional because the stigma is very strong. The stigma is not only against the people with mental health disorder, but there's also a stigma against the mental health professionals. That's why it's very hard
What's the
to
stigma?
penetrate.
What's the stigma all about when it comes to this mental health profession?
Yeah,
Why would
that's a
they have
very
to?
interesting question.
Yeah.
Well, the stigma is, I might say that is quite less harmful than the people with mental health disorders. But uh, when it comes to the mental health professionals, okay, there's a lot at least in our country. Um, you cannot see a psychological clinic here in the public place. Usually, it's in a hidden place. You cannot see
Okay.
streamers or
Yeah.
banners because it's people would be very ashamed if they are seen entering those kinds of
Yep.
establishments. And the mental health professionals here are, if I may say, since it's a very young profession, almost 5 years. I mean, when it comes to the licensure,
Yeah.
uh, we do not have any competitive salary at first, so it's not very attractive for most people. But since our profession is about helping, so still do our best. Now, some of the stigma would be towards people who are practicing this. There's a lot of misconceptions. Okay, for example, wait, I'm just drink water.
No problem. Yeah. Hey guys, who are live, please feel free to like and follow our channel. And yeah, if you have any comments, please feel free to drop it down. And yes, Sir Jax will be more than happy to help you out with your concerns, and we can make this world a better place. And we're promoting a lot of programs for the communities out there. Yeah.
Yes.
Yeah. Back to you again,
Thank,
Sir Jax.
thank you, Thomas.
My
Anyway,
pleasure.
uh, usually, well, people, the stigma that we're getting is not actually not, well, I cannot say it's harmful, but this misconception would be harmful if it would hinder the people to go to us. For example, people tend to believe that we can read minds. We always get that reaction. Oh, you're a psychology major. You're a psychometrician, a psychologist. Can you read my mind? No. Why should I read your mind?
Yeah.
I didn't study BS telepathy. But anyway, we would like to be known as helpers. This is something that we would like to communicate to the people. So actually, there are a lot of efforts, I believe, in the part of my colleagues they're actually more visible in the television now,
Mm.
and which I'm happy about because they're being consulted in things that might
Mm.
concern mental health in
Mm.
comparison before.
Mm. Mm.
Um, Also, there is also the stigma that you should, well, therapy is expensive.
Oh, yeah, it is.
Yeah.
It is indeed. Yeah.
So they would say, or they would joke, so most of the jokes of the people here would, they would just say that an alcohol would cost you 100 pesos, or therapy would cost you thousands of pesos. Just drink alcohol, their problems would be solved.
Yeah.
uh,
Yeah. Yeah.
or they
Sorry to
may,
interrupt
yes,
you, Sir Jax. I mean, the thing that's why it actually makes it harder for people to reach out because when it comes to the fees, even here in Malaysia, if you were to go to a center for
mhm.
psychological
Oh,
treatment,
mm,
it'll cost you at least 300 ringgit, on its own for one
oh,
session alone, and that's not including medications, and that's where
oh,
we will find it really expensive.
I
That
see.
you end up, I think, with a bigger dilemma at hand
Yes.
after that. Yeah.
Well, I'm not aware about the conversion, but
Mhm.
since you said that medication was not included there,
Yes.
I guess it's very expensive.
Mm.
Because supposedly it should be in a, some of the clinics I know would have a package,
Mm.
assessment
Yeah.
therapy,
Yeah.
and refer to a psychiatrist for
Mm.
medication.
Mhm.
But anyway, yes, I agree with you, right? That is one of the reasons as well why mental health programs among communities must be promoted. If you promote mental health programs,
Mhm.
because therapy, medication, those are interventions. So the assumption here is the person had developed the disorder by the time.
Mm.
So what can we do are preventions.
Mm.
So preventive measures such as mental health campaigns or
Mm.
programs in the community might actually lessen the chances that more people would develop disorders. That is one of the goal there. That's why
Mm.
we need to promote programs among the
Mhm.
communities when it comes to mental health uh, care.
Mm.
Now, and also because of that, also I just remembered about that, about the insurance. I'm not sure if in mental health care is included in the insurance in your country, but in our
Uh,
case,
mhm. Mm.
I believe it's not in. They're still in the public consultation, I believe, level.
Exactly. Yeah. 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 If I'm not too wrong as well, it's not actually covered in most of the insurance policies, which makes it harder. If you compare to America, I think that's where they cover
Mm.
that. There is an
Yes,
area
yes,
of treatment where I reckon they actually insurance covers mental health, which is a very
yes,
important area right now, especially with COVID
yes,
being
yes.
around. Yeah. Yeah.
And since you have said it, I agree with that. Especially
Mm.
right now, since we are facing a pandemic,
Mm-hmm.
this is a global health crisis.
Yeah.
But this is not only about, of course, COVID is about physical health,
Mm.
but also the presence of this pandemic is causing a rise of mental health concerns, even for
Mm.
people without disorders.
Mm.
There was the data before from our Department of Health here in the
Mm-hmm.
Philippines. There was
Yeah.
a rise of, but anyway, I'm thinking of from another source, but
Mm.
there's a rise in cases of anxiety being felt by people because they're locked down, they're in
Mm.
quarantine.
Mm.
So people lost their jobs. Suddenly, they need to stay at home. They
Mm.
are actually anxious if they can get or be they can get COVID from just simply going outside.
Mm-hmm.
So uh, and we, as I have told earlier, we that our mental health care is not that competitive yet.
Mm.
So I'm not sure if how many years would it take before the mental health care would be involved in the coverage of the
Mm.
insurance policies
Mm-hmm.
here.
Mm-hmm.
But it was included in our law, so I hope we follow it, and I hope
Mm.
we would have the budget for it
Mm.
because
Mm-hmm.
at now we are focusing on COVID-19 response.
Mm.
But anyway, uh, continuing with this infographics.
Mm.
So in the community level, now the community, of course, is we have a lot of communities around the world.
Mm.
Yes, we in Ghana, we are
Mm.
in one region in
Mm.
Southeast Asia,
Yeah.
and those that region is composed of a lot of communities.
Mm.
And well, I'm trying to find a particular data about
Mhm.
the comparison of the
Mm.
mental health care system
Mhm.
in various Southeast Asian countries,
Mm.
but I can't find
Mm.
anything. Maybe I'm not that good in researching, but
Mm.
as though I cannot see.
Mm.
But there's a trend that I'm seeing from the data that I have read. Uh, that is most the Southeast Asia will we are somehow below from other regions.
Mm.
That's why I think this kinds of programs or activities that we're doing is very important.
Mm.
Um, because we are trying to take action because
Mm.
uh, if for example, in our case, if our government is not prioritizing mental health as of the moment, there are a lot of groups or organizations who are doing their share or their
Yeah.
what they can, okay, to go to the communities and to do what they can do to help.
Mm. Mhm.
Anyway, in a more summarized manner, as you
Mm.
can see here in this particular diagram,
Mm.
uh, so the individual which has a lot of factors that should be considered such as the social skills, cognitive ability, personality,
Mm.
gender, motivation. There's a lot of factors that must be considered about the
Mm.
individual, especially when it comes to mental health.
Mhm.
And also, we need to see it now on the larger circle here, the
Mhm.
family. Okay,
Yeah.
how the communication patterns, what is the structure of the family, what
Mm.
is actually the culture inside the family, what
Mhm.
was being taught to you by your family,
Mm. Mm.
and in a larger context outside your home, in the environment, school, church, government, the community. Okay, there are other issues that might affect the mental
Mm.
health of a person.
Mm.
And that's why we always say that mental health is not always about people with psychological disorders or well-being. This is a
Mm.
conversation about a lot of issues like
Mm.
discrimination, poverty,
Mm. Mm.
housing, uh, and other issues in social issues that
Mm.
are
Mhm.
actually in from the macro to the micro level would
Mm.
affect the mental health of a person in that
Mm.
particular community.
Yeah.
Now, okay, I have this is the only table that I saw
Mm.
uh, from the World Health Organization.
Mm.
This is actually a comparison of this in 2014. So I'm not sure if what is the situation right now. It is
Mm.
the mental health workers available in the Southeast Asian regions.
Mm.
Uh, the 100 per 100,000
Mm.
population in
Mhm.
2014. So I cannot read everything,
No
but
problem. Yeah.
I'm trying to search for our countries here.
Mm.
Uh, example, psychiatrists.
Mm.
Can see we have less psychiatrists here.
Mhm. Mhm.
Malaysia has, there are actually some countries with, for example, Bangladesh, they have no social workers.
Mm.
Uh, they have less nurses and psychologists. For the psychologists, I believe, Malaysia have 0.89, is at 0.07. So
Mm.
that is not very promising. Well, the case, 2014 during that time, we don't have any licensure
Mm.
examination for psychologists. So we don't have technically a professional psychologist.
Mm.
So I believe that's why we have 0.07 here.
Mm.
Also, it's very alarming because during 2014, Myanmar and Laos has zero. They don't
Mm.
have any psychologists. So
Mm.
this is very alarming for me. Though I hope the more updated version of this is, I hope there's a rise.
Mm.
But since I'm a part of the professional organizations of the
Mm.
psychometrician psychologists here in the Philippines,
Mm.
our data of our ratio actually is telling us that for the psychologists in 2019, we have one psychologist for 100,000 Filipinos.
Oh, okay. Yeah, yeah.
So that is the gap is very big.
Mm. Okay. Mm.
So
Mm.
that's why and we are actually encouraging more students
Mm.
to enroll and to train
Mm.
under to be mental health
Mm.
professionals.
Mm.
But
Mm.
also we have this particular strategy wherein we also tap the people in the community.
Mm.
or we call them paraprofessionals.
Mm.
There are particular things that we do. For example, is psychological first aid.
Mm.
Um, you don't need to be a mental health professional to do it. You
Mm.
just have to be trained
Mm.
by a mental health professional to do it. We are now tapping the people in the community to help
Okay.
because
Okay.
we have this particular problem that okay,
Mm.
the ratio is very much the gap is big.
Mm.
So why not tap the people in the community?
Mm.
Because that is another way actually to promote mental health programs in the community
Mm.
when you actually involve them in the
Mm.
planning, development,
Mm.
execution, they would appreciate it more.
Mm. Okay.
Now, how to promote mental health among communities?
Mm.
How can we further promote? Um, this is from World Health Organization. So
Mm.
these are some of the ways that they've said that we can promote mental health
Mm-hmm.
programs among the communities.
Yep.
They said that countries must focus on early childhood interventions.
Mm-hmm.
I really agree with. We
Mm-hmm.
should have interventions and preventions
Mm-hmm.
as early as to the children. And
Mm-hmm.
support to children, socioeconomic empowerment of women or other, I may say, minorities or vulnerable groups,
Mm-hmm.
social support for elderly populations,
Mm.
programs are targeted at vulnerable people,
Mm.
especially those people who are minorities, mental
Mm.
health promotional activities in schools.
Mm.
Now, something that I really appreciate now here in the Philippines, a
Yeah.
lot of schools now are adapting to this. Mental health is part of their, if I may say, priority program
Mm.
for the
Mm.
students,
Mm.
both for the students and teachers. We are
Mm.
being invited a lot in their programs on student and teachers' mental health.
Mm.
Mental health interventions at work as well,
Mm.
housing policies, violence prevention,
Mm.
anti-discrimination laws and campaigns. So these are just
Mm.
some of it.
Yeah.
Also, if I may add here, we can also make campaigns,
Mm.
perhaps. In our country, our smallest unit of community is called barangay. So
Yes.
it is
Yeah.
composed of different families in a
Mm.
particular area.
Yeah. You have your
And we have,
tanods, am I right? Yeah.
sorry?
The tanods, am I right? Tanods of a barangay.
Yes, we have the Thanos. That's
Yes.
why they are. If you would think about it,
Mm.
they that is a microcosm. That is a small community,
Mm.
and when you think about it, the barangay was
Mm.
being the government there is the barangay hall, the
Mm.
barangay local government unit. That's
Mm.
why one of our plans for the next year is actually train the people in the barangay, the
Mm.
anods, the the what do you call them, the the health workers,
Mm.
the barangay captain to actually we try to convince them to include
Mm.
mental health campaign in
Mm.
their what do you call this
Mm.
program. Okay,
Mm.
for
Mm.
the we had done it with some barangays, but I hear the same concern. Their
Mm.
concern is we do not have the budget for it.
Mm.
So that's why I told myself, okay, so if you don't have the budget,
Mm.
we would do it for free. So
Mm.
then we decided to create this organization of volunteers and we go to the barangays. As of
Mm.
now, we do it for free because there's no clear mandate from the national government.
Yeah.
Though it was included in the law that
Mm.
mental health care must be up to the barangay level.
Mm-hmm.
What is
Mm-hmm.
actually being expected here in our country is we have a mental health professional, at least one per
Mm.
barangay.
Mm.
And well, of course, that, if I may say, that would be years away from reality. So we
Mm.
are doing what we can for now.
Mm.
Okay.
Mm.
Also, uh, we had some seminars and activities in the communities in the barangays,
Mm.
and it is actually nice because you can actually see people who
Mm.
are learning or the people in the community who are now more curious about
Mm-hmm.
mental health because
Yeah.
they have a lot of misconceptions here about
Mm.
mental health.
Yeah.
And because of that, they are being now encouraged that, for example, there's an instance when I was talking to the elderly in the community.
Mm.
After the talk,
Mm.
they approached me and asked me where can I go if I want to have a psychological assessment or if I
Mm.
want to for mental health care. So I was happy by the time because they are now more open to that possibility.
Mm.
And having that instilled to them, because I always believe that awareness is always the first step. Then awareness would be now translated into action.
Mm.
Now they are now hopefully taking action. So
Mm.
hopefully our local government units would now do their part as well
Mm. 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 Yeah.
in a way.
Yeah,
And
I've
because
got
of
a
that, yeah,
question. I've
sorry,
got a
sorry.
question though from YANA itself, where the question is:
Yes.
many in Southeast Asia are actually less inclined to pursue psychology or counseling, as there aren't enough good-paying job opportunities and market demand. So, what do you think about this?
Yes, that is true. But that is another problem, I believe.
Mm.
Because anyway, I'm not sure if I have understood the question right. Uh, is this about the less opportunity for people who are working in the mental health care?
Yeah, I mean they're less inclined because basically they're looking at aren't any good enough paying jobs,
Yes.
and due to market demand. So so
Oh,
probably
okay.
they're less inclined. Possibly there could be a factor of not much of money that's involved in terms of remuneration or payment into their own bank balances. So probably that could be one of the factors that making people less inclined to pursue in the areas of psychology or counseling. So probably that will be the question. And what's your opinion on this?
Okay, thank you for that question
Mm,
because since I am teaching in the university, my students are taking up BS psychology.
mm,
Now, when I ask them if they want to be a psychologist,
mm.
most of them would say no.
Ah,
Uh, because I was surprised by that because at first I would assume that okay, you enrolled in BS psychology, so
mm,
probably want to be a mental health
mm,
professional.
mhm,
But I have nothing against it because
mm,
that's my students' dreams and
mm,
plans.
mm,
Most of them in our country, psychology as a degree is a stepping stone for a
mm,
further degree such as
mhm,
medicine, law.
mhm,
But
mhm,
anyway, I have nothing against it. But my problem is, as you have said,
mm,
um, we there are less people who are attracted to enroll.
mm,
So I might say that I have observed here that more people enrolled for the past years,
mm,
but the people who are actually practicing,
mm,
that would be the problem. Well,
mm,
there's a lot of concerns there. Number one would be very non-competitive
mm,
salary.
mhm,
Number two would be the opening of the positions
mm,
or companies, schools, or government that would
mm,
actually hire a mental health
mm,
professional.
mhm,
So
mhm,
in our case, most of us would see us in the school teaching or researching. Some of us have their own clinics, but it's a few. So we are having we're doing our best to earn in some other ways that is still related
mm,
to our license or our course. Well,
mm,
I believe that is a very valid concern. I tend to believe that this is only a problem in our country. That's why I was
mm,
surprised that it was a problem in other countries as well.
mm,
That is why I believe if we go back here in this particular slide,
mm,
the WHO actually emphasized that mental health promotion should be mainstreamed into the governmental and non-governmental policies and programs.
mhm,
Because in the end of the day, it will all go back to the people who are actually in charge of the policies.
mm,
It should
mm,
be the
mm.
government. If the
Yeah.
government now open opportunities, for example, in our case of our mental health law, I was
Mm,
very positive about that as a mental health professional because I
mhm,
felt that we are needed. This is
mm,
okay. The Philippines is now telling us you are needed
mm,
because we had the licensure, we had the law, and the law
mm,
is telling us that okay, we need mental health professionals.
mm,
Now, having that in mind, of course, I had this particular expectation that the government would now, if I may say, mandate
mhm, mhm,
companies and other institutions that okay, you should
mhm,
have at least a mental health professional in your place, in your
mm,
organization.
mm,
Now, as of the moment, it is not. I believe it's not happening yet, or maybe I'm
mm,
not just not aware if it's happening.
mm,
Um, so with that, I think the government must be convinced that the different communities and institutions and organizations must have a mental health professional And so therefore, it would now open a market. It would now open opportunities. It would now open demands. So, and people who are actually thinking, should I get psychology or mental counseling as a course? Then hopefully more youth or maybe someone is watching right now who are thinking about it would enroll and would see himself or herself as helping in the helping profession.
All right. Yeah.
Oh, anyway, in addition to the health sector, according to this, it is essential to involve not only the government but education. That is very important if it's integrated in the academe, labor, justice, transport, environment, housing, welfare sectors. So as we can see, the talk about mental health is really beyond the disorders or well-being. It is a very an issue interrelated to other issues, the other concerns.
Yeah. Okay. Yeah. I've got another question for you though,
Yes, yes.
and this is from Yana, and the question is: how can educators and parents be trained on mental health and its first aid? What programs or initiatives are you aware of?
Thank you for that. That's a very interesting question because
Yeah.
I actually support those kinds of activities. We actually did some before. We trained teachers and parents.
Mm,
Now, for the mostly teachers, because teachers are always with the students.
mm,
So, since it was emphasized that mental health must be uh, integrated in the curriculum and must be a primary concern of schools.
mm,
So, aside from usually in our country, the guidance counselor, the counselor is the one who is overseeing this thing. And when I was actually, we have a particular partnership right now with the Department of Education in our case. So we are helping them to create a mental health program for their school. So one of the things that we found out from our needs assessment is that the guidance teachers are actually having a hard time because they're only one and they have 1,000 of students. So they actually suggested that why not involve other people for the training, like the teachers, because in reality, the teachers is the frontliner. They are the first people that the student would approach. So we had this particular training before for psychological first aid. We trained the teachers, especially teachers, as I have said earlier, the first people who would see or the problem. And they may actually also aside from that the basic mental health first response, how they would respond if their student would have a panic attack, or as their student would have this anxiety attacks or suicidal behavior, suicidal ideation. How should they address the students? How they should be helped? So the teachers were trained, even other personnels. So there are particular what we did before. We had collaborations and partnerships with schools, and we offered our training services for free because that's part of our advocacies. And as for the parents, we as of the moment we're having seminars or webinars for the parents. So I would admit that it's harder for the parents. It's harder to for the parents because parents, obviously they're parents. They love their kids so much. So uh there is it is very hard, at least for me. This is just my personal experience opinion. I usually get scared when the parents are the audience because
Yeah.
uh they are really defensive
Of course. Yeah.
when they're having talks about mental health, especially about their child. In our culture, I guess also in other Asian cultures, whatever happened to the child would actually somehow would the people would think that it's a reflection of the upbringing of the parent. So the parent is very
Yeah.
I may say careful about how
Okay.
their child will present themselves outside. So
Yeah.
they're quite defensive. Some would not actually agree that they are the cause of the mental health condition, or I may say the aggravation of the condition of their child. there's a very hard conversation, but it's a conversation that must be open. So we always try to talk to them. And have the school is helping us to gather the parents, and we will have a conversation with them regarding that. And well, in some cases, they are more open for that kinds of talk. Uh, in some cases, they're not that ready, so we will monitor them. We're telling them if you're ready, we are very much willing to talk to you. For example, there are particular moments in our FB page. A random parent would chat us and would ask us, my kid is, I observed that my kid is experiencing this, etc. How can I help my kid? So it is. I just appreciate those kinds of parents as well,
Yep.
that they know that they're actually accepting the fact that their kid needs help. But uh, should they answer the question?
Yeah, of course, yes. Oh, we got another question also from Terence
Yeah.
on his question is many who are confused where to look for help. So, it's basically psychologists, psychiatrists, therapists, counselors. So how do we solve this, and how to identify experts in each area?
For that question, Terence, that's actually one of the. I believe that's one of the first concern that was addressed when we had the public consultation regarding the mental health law, because that's right. People would always ask me or us, okay, we now accept that we need help, but where can we find help? Because we always say in our slogan, mental health advocacy, help is available, help is here, but where
Yeah.
it is, where is it? But anyway, um, so one of the ways that we did, or no, I'm not really technically directly involved in that, but I just participated. There's an organization that was created in our country. It's called Mental Health Awareness. That is where awareness. So what they did is actually they map out all available clinics or organizations, hospitals that actually offers mental health care. So we are continuously creating this database where per area in the Philippines we can pinpoint or direct the people that you can find a particular clinic here, you can find a particular professional here,
Yeah.
and
Okay.
this is the particular rate, these are the services, this is what you can expect from your visit. Now, however, it's still on the work because there's a lot of things to do. Also, I had this particular idea that I want to pitch in last time in the meeting.
Yeah.
I'm not sure if this is feasible, but I asked them if it's possible to have a particular application since most people is into smartphones. That application would actually help to map out for example, I want to visit a particular psychological clinic. Then, pretty much like Siri, we will ask the
Okay.
app, where's the nearest clinic
Yeah.
here, where's the nearest psychologist here,
Yeah.
what is
Yeah.
the services, what is the rate. So
Yeah.
but anyway, this is in my imagination right now. I'm not sure if other countries are doing that, but I think it would be more helpful, especially some people are still shy in asking.
Yeah, that's basically the reason why. It's basically that shy feeling that makes people not want to ask, and that's what it makes it a little bit challenging. Yeah?
Yes.
Yep. Yeah, would definitely agree with that. Yeah.
Do we have more questions?
Yeah, we do. We do have another question that just popped in, and basically is how do we track the effectiveness of our mental health projects, etc.
Oh.
A bit of a challenging one there.
Yes, it's a very challenging question. I at the end of the day, every after our project or community activities, I always ask myself if if what we did is actually really helpful. Or by the way, that is a common concern in project development, right? You need to evaluate if it's actually helpful. And as much as possible, we want a program which is sustainable and continuous. So you can monitor if there's actually changes because that would be your criteria or basis that, okay, it's actually working. Or if it's not working, what would be the areas for improvement?
Yeah.
Well,
Okay.
in our case, what we do to actually measure or track or monitor if it's actually effective, we have at first we have evaluations. We always do that. We ask the participants to evaluate as honestly as possible, and also we go back to the communities. Or if we cannot go back, especially because of the situation right now, we're actually having a point person in the community that we will message from time to time. For example, in our case, we in our community engagement committee, we are creating a particular database of the point person. So we want to know what would be the effect. Are there any significant changes? If not, what do they think that we should do? Um, Basing on the feedback or evaluation of the actual participants themselves, then actually, as being emphasized by the mental health professionals, we should make sure that what we're actually doing or developing, excuse me, is a um, is evidence based. It is based on research. That's why there are particular projects that we are consulting to psychologists first if this actually helpful. Uh, if that is actually there's an evidence that it would help the people. So that is one of the safeguard the safety net as well. So and we do not usually we continuously, as much as possible, we continuously what do you call this, connect or relate to the people that we encountered. Most of them are, for example, what we did last time, for those people who are still interested to know more. So we created a particular Facebook group and they joined there. So we can update them from time to time, especially if they want to share something or they want to join the future activities. And we're still working on other ways in how we can track actually, but that's very important because we cannot just go to a community and do an activity then go. And when you go from that activity, then you would not care about them anymore. So of course you need to know if what you did is actually helpful.
Yep. Hope that answers your questions on that. Yeah. Thank you very much, Sir Jax, for
As
that
well,
response. Yeah.
they're very interesting and challenging questions.
Yeah, yeah. 'Cause everyone's concerned on this in this area and how to find a solution. So yeah, wonderful. Yeah, so keep filling in the questions. Yeah, I'll leave the floor again to you, Sir Jax, for your presentation.
Okay.
Yeah.
Actually, it would be my turn to ask a question.
Uh-huh.
uh, now, how do your communities promote mental health? Now, for our audience, I would really like to know because maybe I'm always a fan of the collaborations, of sharing of best practices. I always believe that you will always learn from other people. So, if you have noticed for our audience right now, uh, mental health programs among your communities, I would just like to know, or maybe the other audience would like to know as well. Maybe you can share it in the comment section.
Yeah, please feel free to leave your comments and share the question as how do how do your communities promote mental health as stated by Sir Jax?
With
Yeah.
that, with that, I would ask you, Thomas, as well.
Mm-hmm.
If within your the community you're in, how do your community promote mental health?
Well, in Malaysia itself, again, it's like how it is in terms of an Asian country. We tend to not have much of these activities on a large scale, or I would say more on a wider scale. So people tend to have problems, but they're unable to reach out. They're unable to, come out and approach people, or even if they do it, I would say it's a very hush hush kind of a discussion where they probably meet a personal psychologist or psychiatrist and no one knows about it because they're either shy because first it's a bit I can't tell about my problems, or maybe I cannot share about my issues because people might look down on me, or people might say that, oh, I have PTSD, okay, stay away from this guy, he could be a little bit off his head. So I would say the promotional level in Malaysia itself is still not much there because people find this topic of mental health an area where it's all mind over matter. But I would like to go against it because it's sometimes it's not just mind over matter, because this is my personal opinion, because sometimes we have problems but we need to relate to somebody. So in terms of a connection between people or coming with promotions, we don't have much of that. So, if say for instance, if I were to go and approach a psychologist, is I either go for a government check or I can go to a private one. So normally for what happens is when you pay a little bit more premium, of course you're going to get better treatment and probably more attention and concern. But that's where that little bridge that we want to reach out, where we can um, make it a bit more affordable. So Malaysia yet to see much promotional mental health campaigns. So that's why we've come up with YANA, so people can be part of the group and to reach out to us. And at the same time, we can also help others who are probably going through issues and come to us, and then we be able to find solutions, save lives before something bad happens. So I would say the communities, the promotional side of it is not much, but on our end, we are doing our best to reach out to a lot of people to help them out with whatever they're going through.
Thank you for that, Thomas. And
Yeah.
actually, I just realized while you're sharing that what is actually YANA is doing is part of the promotion of mental health among communities. That's why I really appreciate what you're doing here in your organization. And because you have this, at first I was actually shocked because I thought to myself that, oh, they have a very wide reach.
Yeah.
There's a Southeast Asia region. I was
Yeah.
like, how can
Okay.
they reach that? But of course, I was very ecstatic because there's a particular group who would like to address this, to open the platform for the region. That's why I was also sharing this to my org mates. I told them that this is a very nice advocacy and platform that they're having. And we our group in SinagDiwa, we're actually, and I believe I have told parents about this. We are very much willing to operate and to help Yana in your activities in the future.
Wonderful.
And
Yeah.
yes, and I do hope we have a continuous partnership as well.
Yeah, of course, yeah. We'll look forward to such collaborations for sure. Yeah.
Anyway, was waiting for their answers
Uh,
for I was looking at my phone actually.
okay.
Oh, but maybe they would share their answers later.
Mm.
But anyway, I would like to continue if it's okay.
Yeah, sure. Please go ahead. No problem. Yeah.
I still have time. Sorry, I lost track of time.
So yeah, we do. We still have
Okay.
we still have a couple of minutes to go. Go ahead. No worries.
Okay,
Yeah.
okay. Thank you.
Yeah.
You know, that's my usual usual problem when I talk.
Yeah.
I just talk and talk.
No
Anyway,
worries. No worries. Yeah.
this is the. I'm sorry if for this low-key promotion. This is our group, SinagDiwa Volunteers for Mental Health. So if
Right.
you're interested to know more for our audience about our group, you would see that we have accounts for Facebook, IG, Twitter, and soonest for YouTube. Since this would be part of our project as well to reach the community, because we believe, since we had realized that the community was very much attached to their phones, then why not make social media or social media as the common place for this
Yes.
conversation. So we would
Of course.
open the YouTube channel probably. And it's open, but the launching would be next year. So
Okay.
our idea here is to monetize it, and all the funds would go for helping the community to have a better mental health care.
Yeah. Okay.
So we will have contents here about mental health awareness or talks like this. So I'm also hoping that we can feature Yana here in some episodes. But anyway, okay, I'm sorry for that low-key promotion. I
No
would like
problem.
anyway, for those who's wondering, since SinagDiwa is a Tagalog or Filipino term,
Yeah.
Sinag actually means enlightenment,
Oh, okay.
like in
Yeah.
Sinag. Diwa actually is consciousness.
Conscious.
So technically, it's to enlighten the consciousness. So for
Okay.
mental health awareness.
Yeah. Wonderful. Yeah, I think that it's about time everyone is it's aware of mental health is no longer a taboo topic. Everyone should
Yes.
be able to reach out to anyone, anywhere, any part of the globe. So yeah, guys, please follow and support Sir Jax in the pages that he has listed. SinagDiwa, let's create this enlightenment for not only Philippines, but for the entire ASEAN and also the entire
Yes.
world if possible. Yeah.
Thank you for thank you for that, Thomas. But anyway,
Pleasure.
I would I believe I would show my video now.
Okay.
I hope this will have a sound. Is it appearing already?
Yeah, can be seen. I can see the video here.
Pull the windows down. The night was young, so we'd hide on the sheets until the dawn. We were calling out familiar thoughts when we'd find spaces that we once dreamed of. Bright eyes taking in, wondering when it begins. Quiet sky, open mind, and all the fear cast aside. Sunrise, I have run this far still to find you. Sunrise, show my weary heart that a new day will soon arrive. New day will soon arrive. Pull the windows down to the wild wind. Better days arrive, darling, if we let them in. Quiet sky, open mind, all the fear cast aside. Sunrise, I have run this far still to find you. Sunrise, show my weary heart that a new day will soon arrive. New day will soon arrive. Maliwanag, 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 maliwanag. Sunrise, I have run this far still to find you. Sunrise, show my weary heart that a new day will soon arrive. New day will soon arrive. Sunrise, I have run this far still to find you. Sunrise, show my weary heart that a new day will soon arrive. New day will soon arrive.
Wow, that was a nice one. Yeah.
Thank you for allowing me
Yeah.
to share that.
Amazing work I see that you do there. You know, a lot of I would say a lot of effort is taken on your side to create to reach out. You know, and amazing. You know, I see that you're very dedicated on your efforts, and kudos to you. That's exactly what I would say right now.
Thank you so much for that.
Yeah.
And I cannot take all the credit because this is my organization are really great people.
Mhm.
They are really kind-hearted people, and they really would love to help the community. So when we were asked about the SinagDiwa and our group, It's always our primary mission to bring mental health awareness and health closer to
Mm.
communities.
Okay.
And I really do hope that we are somehow achieving it step by
Mm.
step, gradually,
Mm.
through training, collaboration, and
Mm.
outreach.
Mm.
Anyway, I believe that would yes, that would be my the last part of my presentation.
I see.
And
Yeah.
yes, and I always the one of the quote there by Malcolm X. I always
Mm-hmm.
remind myself about that. That when I is is changed to we,
Mm.
even illness becomes illness. So
Mm.
that's why I always try
Mm.
to know to convince people, to talk to
Mm.
people, to
Mm.
collaborate with
Mm-hmm.
organizations.
Mm. Mm.
Because when you start
Mm.
enlightening one, that particular
Mm.
person would enlighten others, then
Yeah.
a
Okay.
ripple effect.
Yeah. Yeah. Of course. Of course. Yeah. It takes the action reaction to
Yes.
create that
Mhm.
ripple effect. Yeah. Yeah. Well, I've got a question for you though.
Yes.
I mean, you know, from your promotions, you know, in terms of mental health programs. I mean, I think the pandemic has, you know, caused a lot of people to go off key. People are lost in their own worlds and in stuff which, you know, they don't know exactly what they're doing. And because, you know, probably they've been a breadwinner and suddenly they're, you know, they cut off a job, salary cuts and all that. I mean, how do you advise people who are, you know, in the state of in a dilemma to stay positive in the midst of this pandemic? So, you know, they don't, you know, tend to go into areas such as suicide because, you know, the suicidal rates have increased. And I think a lot of people are just taking their lives. And just recently, there was a story of a person who even who attempted suicide, but somehow she was saved. So, you know, what is your message to people to stay strong in this positive? I mean, to stay positive in the midst of this pandemic.
Thank you for that, Thomas. That's actually a reality in various countries right now.
Mm-hmm.
Uh, and as I have told earlier, this pandemic actually became a risk factor for people who are actually very vulnerable for different psychological disorders and
Mm-hmm.
development of these particular conditions,
Mm-hmm.
anxiety, suicidality. There's really a higher rate of instances or
Mm-hmm.
cases. Now, um, that's why even in the virtual platform, such as what we're doing right now, it is very important we should continue these kinds of activities and things
Mm-hmm.
because we are trying to reach the people
Mm-hmm.
that this is what you can do. Now, for the
Mm-hmm.
people who are listening right now,
Mm-hmm.
um, well, this might sound cliche, but yes, there are always people who are very much willing to help you. And for example, if you are confused as to who these people are, you
Mm-hmm.
can message us. Our organizations, I believe, are very much willing to assist you. Also, second one would be self-care. Self-care and proper coping strategies would be in the picture here. Now, and also aside from that, check on your family and your friends
Yeah.
because there might be people who would not approach us. But
Mm.
if you think that you're seeing your family member, relatives, or friends who you believe that are showing signs of mental distress, please help them as well because you are the ones who are with them in the house, so
Mm-hmm.
you can help them as well. Now, for those people who are feeling very, if I may say, depressed mood or anxious right now,
Mm-hmm.
um, there are ways actually to address it. Example, there take time to take a break
Mm-hmm.
in exposing yourself in the things that
Mm-hmm.
you're very concerned about. Second would be uh, sleep as much as possible. I mean, when I say sleep, quality sleep, eat properly. This might really sound cliche to you, but these are actually things that would help our body, especially right now. You're not only doing this for your mental health, but for your physical health as well. Next would be relate and connect to people. Let's take advantage of the technology right now. Because we can really connect to people right now very instantaneously uh, through a lot of platforms, social media, Google Meet, Zoom, etc. You can now connect with people who you believe they can be a source of support. Now, if you believe that you need more specialized or professional help, there are a lot of online counseling or consultation that's available. Actually, we listed in the Philippines. We have a list of
Okay.
a
Mm.
of the organization or clinic that is actually offering free counseling and consultation.
Mm.
So I am very much willing to share this
Mm.
particular link. Maybe
Mm.
later I would share this link. You can share it to your pages now.
Sure,
Uh,
sure, sure. Yeah.
there are about we're updating it, but I believe it's about around 37.
Mm.
You know, you can contact this through
Mm.
your phone, the
All right. Yeah.
convenience of your phone. You just
Mm-hmm.
send a message to them, and
Yeah.
hopefully they can reply in time. Because as they have told me, there's really a rise of people who are going in this particular actually there's a rise of people who are calling in the hotlines, hope
Mm.
lines,
Mm. Mm. Mm-hmm.
suicide prevention hotlines. There are a lot of
Mm.
people are calling during the pandemic.
Mm.
Also, there's a rise of people who are booking appointments for counseling or
Mm.
online counseling. So it would be very. I'm not trying to invalidate your feelings, but I would say that yeah, there is hope,
Mm.
and there are we are here. There are people who are willing to help you.
Mm.
So I do hope the people who's listening to this right now, this particular session, would always keep that in mind.
Mm.
Um, I guess that's it.
Yeah, thank you. Yeah, that was a very, 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 very good answer that you gave. And yeah, would love to look forward to your link and where we can, learn and how to we can reach out from the online platform from your side as well, and get solutions that are required for to prevent something, preventing the worst from happening, and being more safe. Yeah, we've got another question here from Yana, which is and says, "Greetings, Po. What is your wish for mental health in the future? Which aspect of the mental health law can be improved?"
I can't help but to smile. Like if I'm when I was asked when I am asked about how I envision mental health, not
Yeah.
only in the Philippines but in every country.
Mm-hmm.
I believe I would dedicate most of my life for this. I really would like. I hope that I would not die without seeing this happening.
Mm-hmm.
Um, I would really like to envision a society or community which is very much accepting of people
Mm-hmm. Mm-hmm.
who are suffering or have mental health issues.
Mm-hmm.
A community also which experiences that the members of the community, each and every individual, is experiencing optimum well-being. Because as WHO have said, that is the key to a progressive community. And I really think that when a person has a better mental health care, a lot of other social issues would be solved. There would be less poverty, there would be less crime rates, there would people would be more there would be less discrimination actually. People would be more understanding of each other. Well, this might sound really idealistic, but I believe this is not impossible because gradually I'm seeing progress. And in our case, if I would take the mental health law into the picture here, having a mental health law actually is part of that progress. Actually, if I may share, our mental health law, if I'm not mistaken, was actually 30 years in the making. So I actually almost lose hope that our lawmakers would prioritize it. But since it's here, uh, there's the policy. So we had so people now the government now acknowledges that we need proper mental health care. Now the problem would be now the other question here I believe is how can it be improved? It's more on the implementation. I always say that whenever I read a law, I see that the provisions are very nice, very good, it's very promising. But I always ask myself, when, when we translate this into action, is it possible? I believe that our lawmakers are had done their research about it. However, one of the problem would be the budget. That's one of the things that I am really concerned about the mental health law. The budget allocation. If I'm not mistaken, the budget allocation for mental health right now in our country is around 5% from the 100% of the budget of the
Just
Department of Health.
wow. Okay.
So
Okay. Yeah. Just
having
okay.
now
A small figure there, yeah.
Yes.
Okay.
And there was also a debate, if I'm not mistaken, in the our Congress. One of the lawmakers or congresswomen was actually very surprised that if we actually divide it into 100 plus million
Mm,
Filipinos, so every Filipino would only have five something pesos each
mm,
for their mental health care.
okay.
Now, of course, I'm trying to be objective here because it's pandemic. So I believe I understand if most of their budget would be allocated for the COVID response.
Mm,
I'm just hoping that for the following years that a larger budget would be appropriated for mental
mm,
health care because what is the law is actually saying is very good, but we need the mechanism, the machinery actually to
mm,
make it going. And aside from
mm,
that, the mental health professionals as well.
mhm,
If we have the budget, so we need the people who would continuously monitor it and
mm,
to make sure that this the policies of the law would be felt by
mm,
the simplest Filipinos or the
mm,
individuals.
mm,
Um, I'm hopeful that it would happen. I just hope that it would not take too long.
yeah, yeah. But I think yeah, budget has to be allocated, much into this area, because people need help. But though I've always understood that that things are when it comes to the Philippine culture, you guys are very. I mean, I would say in terms of the positivity that I love about Philippines is that
Thank you.
you guys take
Hmm.
things with a very positive stride, and that
Yes.
part actually what drives me to to adopt that into some of my own personal areas of I would say struggles. Because when I see that there's a challenge, then I think when I think of Philippines, I always think of one aspect is you guys are very positive, but of course, we are looking at that little small sector where we can reach out as well and bring that hope to people, and that's where we can um, you know create a better community or say a better impact to a lot of people. Yeah, so just hope the government, as you said, would come back and increase the budget so we can help a lot of people and listen to them a little bit more. Be good listeners at the end of the day. Yeah. All right.
I really appreciate what you have said, and thank you for
Yeah.
that.
Yeah.
Um, yeah, culturally speaking, yes, I believe
Mm,
that's one of the real
mm,
positive traits of Filipinos. We're very
uh,
much um, as much as possible, Filipinos would try to see things in a positive
mm.
light,
Yes.
even the
Yes.
negative ones.
Yeah.
Um, that's why I can't help but to think that if
Mm,
Filipinos by default
mm,
are happy people,
mm,
so just imagine if these people would have a better mental health care, so that
mm,
would actually very more helpful.
mm,
And it's the same wish that I have for the other countries as
mm,
well,
mm,
not
mm,
only in the Philippines.
mm,
I
mm.
I always see that because the country is composed of people.
Yeah. Yes, of
So,
course.
and that's why it's very much important that
Mm,
uh, most of what this is my personal opinion.
mm,
Most of what we see right now around us,
mm,
everything is
mm,
came from more or less from a person's mind.
mm, mm, mm.
Then the things around me, there's a
Yeah.
person who think about of doing these things.
Uh,
So it's very much important to give emphasis in
mm,
the health of the mind.
mm,
Uh,
mm, mm.
but anyway, and uh, by this, I believe if all countries would actually prioritize it,
Mhm,
I
mhm.
believe their citizens would have a better quality of life.
Yes, of course, of course. Yeah, it would definitely improve the quality of lives in many countries. If everyone could reach out. Because again, from what we have to understand, that mental health doesn't mean that you actually have a problem or you are a problem. It's just that it's just the tightening of the screws in the mind that that you need to do, and that's where sometimes we fail to understand, and and help out certain countries which have this, I would say, shortage of assistance when it comes to mental health. So yeah, and good. I mean, I would say that fantastic work that you do, and appreciate all the things that you've done, and let's work together on this to
Yes,
make to make this world a better place. At the end of the day, that's the main goal, the aim of everyone is to make this
I
world a
agree.
better place. Yeah, yeah, yeah. That's right. That's right. Yeah. All right. Okay. Thank you, Sir Jax, for your time.
You as well.
It was a pleasure having you here. Yeah, guys. Any one of you would like to follow Sir Jax, you may leave your details later on our Facebook page, so we can reach out to you, Sir Jax, in any way or the other, and we can actually collaborate. In other words,
Yes.
together with Yana, and besides just focusing on your country, Philippines, we can do a lot of collaborations,
Yes.
even out of Philippines, together
Um,
here in Malaysia as well. Yeah. All right.
yes. And I'm very excited for that.
Yes, 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 yes. Thanks. We look forward to that. We look forward to that. All right. Thank you, Sir Jax, for your time. And
Thank you so much.
we hope, guys, you've enjoyed the session. And have a good day. Stay safe. And if anything, reach out, because before it's too late, let's do this. Let's do this and promote more mental health campaigns, programs, and let's work together to make this world a better place. Thank you so much, Sir Jax. And take
Thank you so
care.
much.
Stay safe. Yeah. Bye bye.